Hello, do you suffer from migraines and you've tried a lot of treatments, but you're wondering if there's anything new? I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT and Plastic Surgery, Bangalore. And today we're going to talk about something new that I'm very happy to introduce for the first time in the Venkat Center, and that is migraine surgery. Now, firstly, let us understand what migraines are. Migraines can be classified as severe headaches which are accompanied by other symptoms such as sensitivity to light, nausea, vomiting, tiredness. They can be extremely debilitating and they can take away many days from a person's life in a year. When someone has a bad migraine, they're unable to do anything. They just want to sleep in bed and not go outside at all. I know this because I suffer from migraines myself. And that's one reason why I always wanted to try and find if there was some better solution for it. Now, what causes migraines? So basically, we know that migraine happens because of increased sensitivity of the neurons in the brain. And that is what leads to a migraine. This was always thought to be the traditional explanation. But recent research has found that there might be another component to this. There can be a trigger nerve on the outside of the face, in the skin. And when this nerve is hypersensitive and gets triggered, that leads to the migraine. So the migraine itself is because of the brain sensitivity, but there can be a trigger which starts it. And that's what led to the field of migraine surgery. It was actually discovered by a plastic surgeon. You might be wondering why I, a plastic surgeon, am talking about migraine surgery. So a plastic surgeon in the US by the name of Dr. Chiron, when he did forehead lifts, brow lifts, a lot of his patients said that their migraines had gone away after the surgery. And that led to him doing his research, which led to this exciting field of migraine surgery. Now, how do we traditionally treat migraines? The most common treatments are medications. There are various medications available. I don't want to go into all of them because that's not the point of this video. These medications are effective, but a lot of them have to be taken for a very long period of time and not everyone responds to them. Other treatments which have been tried are Botox. If you identify the trigger nerve, you can give Botox into that nerve and thereby reduce the amount of migraines. We in fact have another video on this and you can check this out. Now Botox is a good treatment, but again it needs to be repaired every 6 months. So that brings us to migraine surgery. What is migraine surgery? Migraine surgery is basically a surgery that is aimed at targeting the trigger nerves, identifying them and releasing them so that they no longer get triggered, and this reduces the severity and frequency of migraines. Who is a good candidate for this surgery? It's important to understand that every migraine patient might not benefit from this. Those patients who have a trigger nerve are those who can benefit from this surgery. So it's important that you are evaluated properly. Also, this is not a surgery to be tried straight away. The patient needs to take medications and try other treatments first and then look at migraine surgery as a step-up option. It's not something you go for right away. So we've been speaking a lot about these trigger nerves. What are they? Well, we have found that there are commonly 4 possible trigger nerves. One is the supraorbital, or the ones that are just above the eyes. The second is the temporal, that are there at the side of the head. The third are the occipital, which is at the back of the head. And the fourth is rhinogenic, or those which are inside the nose. So these are the common trigger nerves in most migraine patients. So what can be the benefits of migraine surgery? Well, the research is very promising. Almost 90% of patients who have undergone migraine surgery have reported some benefit. In those 90%, 45% had complete stoppage of all migraines. The other 45% reported a reduced intensity of migraines, that is, the migraines weren't as bad when they got it, and a reduced frequency. They did not get it as frequently. The last 10% who did not get any improvement probably weren't good candidates for the surgery. So that's why, like I said, it's important that the person be evaluated properly. Now let's talk about the surgery itself. This surgery is done as a daycare procedure. It can be done under local or general anesthesia depending on the patient's preference. You come, get it done, go home the same day. Now, we're going to give the example of the supraorbital trigger site. So, in that, what we do is we make an incision in the upper eyelid. This incision heals very well, and the scar is along the natural crease, so no one gets to know that you had something done. Once we open it, we dissect out and we go and find the nerve. So, when we find the nerve, usually in migraine patients, there's something that is constricting the nerve. It can be a blood vessel, it can be a muscle, it can be a fibrous band, or it can even be bone. So, whatever is constricting that nerve, that is released. And once that is released, the nerve no longer causes the trigger. For the temporal migraine, the incision is made inside the hairline, so it's hidden very well. For the occipital migraine in the back of the head, the incision is again made inside the hairline, so it's not seen at all. And for the rhinogenic or nose migraines, usually a septoplasty might be required. Now, after surgery, like I said, you go home the same day. You can usually go back to work within 4 or 5 days, and it's very difficult for anyone to make out that anything was done. The results of the surgery, typically, you start feeling them after around 4 to 6 weeks. Now, are there any complications of this surgery? It's a very safe, straightforward surgery. Remember, all the surgery is being done inside the face, under the skin. We're not going near your brain at all. So everything is at the skin level. There are only routine complications which can happen after any surgery, such as infection, hematoma. The chance of these complications happening is very, very low, but it is not zero. Now, again, how effective is it? Like I said, almost 90% of patients reported benefit with this. Half of them had complete stoppage of migraine, the other half had an improvement. But choosing the right patient for this surgery is important. So this surgery is still very, very new in India. It started in the US, then it started gaining prominence in Europe, and now we hope to be among the first to bring this to India. I learned this technique in Spain at the Dr. Benito Institute, and we hope to be able to offer this for our patients. As a migraine patient myself, I understand the problems this can cause. I hope you enjoyed this video. If you would like to know more about this, do get in touch with us. Our information is on the screen. Do subscribe to our channel, like and share this video. If you have any questions, let us know in the comments. Thank you. Have a great day.